Hello and welcome to the next video in the series on depression. Today I'm going to talk about why talk therapy is so beneficial in treating mild and moderate depression. Because functioning is not as seriously impaired at these levels, people encouraged to talk about how they feel in a safe and welcoming environment will benefit greatly from talk therapy. How receptive the listener is will also make a big difference. People need to talk without being judged, ridiculed, or dismissed. Unfortunately, people with severe depression will likely only benefit from talk therapy once medication such as antidepressants has been used, as their mental energy and their physical energy levels needs to be raised so they can engage with a therapist or counselor. The difference, by the way, between therapy and counseling is the duration. Therapy is usually long-term, while counseling is short-term, but it can be quite intense. Talk therapy works well because it's about communication and communicating your feelings to someone. And as soon as you do that, you're no longer hiding them or bottling them up. The emphasis is on the communication in the earlier stages because it alerts the listener to exactly what is going on in the affected person's life and mind. Remember that as depression progresses to its worst form, sufferers find communication harder and harder and will speak less and less. If depression is detected in its early stages, there is a very good chance that it can be prevented from reaching its most severe stage. I believe strongly that prevention is better than cure, so I prefer to catch things early. Intervention is then always easier to administer and to digest because the person's functioning is still relatively good and their mental faculties still able to respond to cognitive preventative care actually. So talking to your doctor, a mental health nurse, a counsellor or a psychologist will set in motion a range of events, cognitive events, which should go like this. Your counsellor listens to what you say, notes the language that you're using, and from your narrative creates a picture of your feelings and symptoms. They also read your body language, interpret your facial expressions, and look at your physical state, and thus get a good idea of which stage of depression you're at, which then informs the decision as to how treatment should proceed. I find that depressed clients are often quite drawn, their skin tone grey, mottled, quite poor. They don't smile or laugh, and there's a general sag to their bodies. Sometimes they fidget nervously or they sit very still and make small, very economical body movements. Women quite often start crying as soon as they start talking about their symptoms and apologize constantly for crying and for using my tissues. If I suspect severe depression, I will refer that client to their GP before any treatment can proceed. But if it is mild or moderate, we start to talk, and I can see the comfort it brings straight away. When you start talking about your feelings, you bring them out into the open, you're almost making them visible, and this brings about almost immediate relief. Many people use friends and family as unpaid counsellors, and while I understand that in some cases this is unavoidable, I believe it is better to talk to a therapist or a counsellor. People who don't have a background in mental health may find it hard to engage with you and your feelings and could start worrying about their own inadequacies at not being able to solve your problems. Certainly, I've had this experience with the spouses and significant others of people I've worked with over the years. Listening is good, but often people want answers and feedback, and inexperienced people may not be able to do that. In my practice, at least, counselling is very interactive. It's a two-way street. My clients tell me their symptoms and problems, but it is my job to suggest solutions and to explain why I think a particular course of action is the best. They can either take the advice or we can work out alternative solutions. While I'm not saying that depressed people can't make their own decisions, it is actually harder for them to do so because depression clouds judgment and removes clarity. So I suggest you start with a professional and maybe use friends and families as top-ups. People who love you and care about you will ask you how you are feeling anyway and will take an interest in your life. So feel free to give as much information as you feel comfortable with. But if you sense their interest waning, then stop talking, because it may interfere with your recovery. Remember also that too many opposing views is never a good idea. And I've worked with more than one client who has received poor advice from a friend or a well-meaning friend or family member. Counsellors are also adept at obtaining a timeline of how and when that depression started in that particular person. This is really important because it indicates whether it is recent, due to recent events, or whether it's historical and been around a long time. In most cases, people have suffered intermittent depression, quite often from their younger years, their teenage years, their childhood years. And then I know that counselling will have to become longer-term therapy. It is important to note that there's no quick fix for depression. It has to be worked at. But modern treatment methods are very successful, so you must give them a try. Life is simply too short to spend it being depressed. My next lot of videos will discuss other methods which can be used alongside talk therapy to help with your symptoms. Please keep a lookout for them. Thank you very much for watching. Please like, share and subscribe, and let me know whether there are any issues you would like me to talk about or discuss. Until next time, take care and goodbye.